to start this session, can I just get your verbal consent for this video being recorded for quality and training purposes for the session?
Yes.
Yeah. And with our volunteer patient,
Yes.
you also consent? Yeah, it's good, thank you. So today we're doing the manual pulse and respiratory rate session. So welcome, my name's Natalie, I'm going to be the trainer for today. And I have done this session for about 6 months now. I also host other training sessions. So we'll be doing the manual handling, manual pulse and respiratory rate course today. But if you're interested in other sessions, talk to me afterwards. We can also organize something. So this is our volunteer patient today, Harry. He will be joining us in the second half of the section. So when we practice on taking the manual pulse and respiratory rate. Can you tell us a little bit about yourself, please?
Yes. Hi, my name is Samani Granger. I'm from Sweden. English is not really my first language, so please be mindful of that.
Yep, that's good. So at any point during this session, if you think I'm speaking too fast or you're not understanding me properly with my language or the words that I use, that's fine. Just let me know and I can always go over and explain it again.
Okay.
Yep. Okay. Thanks, Harry. So for the session today, we will be learning about how to independently complete a 1-minute manual pulse rate and also a 1-minute respiratory rate recording. So that's for you to independently learn at the end of the session. We'll try to achieve this goal.
Okay.
Yeah, that's good. So today's session, it will be 30 minutes from 3 to 3:30. And because it's 30 minutes, there will be no breaks today. And we're in the level 1 education office. A bit of housekeeping to start with. If you need the bathroom, just goes out from this door that you came in from, turn left, and the third door on the right, that's the bathrooms there. If you need to take a phone call, just step outside, take the phone call, and then return afterwards, that's okay. In any case of emergency that you need to leave the session, just let me know, we can always arrange another session after. In the case of emergency that we need to evacuate from the building, we'll leave this room from where you come in from, the entrance there, and then turn left, go down the hallway, go down the stairs to ground floor. You will see the courtyard just outside the main entrance there. The courtyard will be where we will gather for the emergency evacuation gathering point.
Okay.
So this session, 30 minutes, will divide into 4 parts, starting with the introduction to get a basic understanding of your knowledge, how much you already know about pulse rate and respiratory rate, followed by some theory. We'll look into more detail of why we're doing it and also how we're going to do it. And then demonstration, I will invite Harry back and also demonstrate on Harry in a clinical setting how we're going to do it. And then towards the end of the session, you'll have some time to practice and there will be a small assessment on yourself to independently record a 1-minute respiratory rate and a 1-minute pulse rate. We'll end the session with some questions and also some feedback. Yeah, so all good so far?
Yes.
So what we need today is we'll need a timer. Did you bring your timer today?
No, I didn't.
That's okay. We have timers around that we can use as well. And we'll need the observation chart where we can record down our results and also pen. So we've got that around as well for you to use. And we also got some hand sanitizer available. And the manual pulse and respiratory rates handouts will be in printed version available today as well. But they are just the same as the ones that I've sent you by email last week. So starting off with an acknowledgement of country, we'll just watch a short video on that. Just loading.
this National Reconciliation Week.
Wherever you are in Australia, we acknowledge the traditional owners of the land.
I acknowledge the traditional custodians of the land on which I stand.
I pay respects to the Gadigal people of the Eora Nation.
The Bundjalung Nation, the land on which I stand.
The Gimli Nation.
I acknowledge the people of the Kulin Nation and pay my respects.
The Wajak people of the Noongar Nation on whose land we're standing.
To the Darawal people of this country, south of Sydney.
I pay my respects to the Larrakia Nation.
The Moina people of Tawita or Tasmania.
And eastern and central Wurrungai in central Australia.
The First Nations people of this area.
From the rainforest to the reef.
Where sovereignty was never ceded.
Even though it's different to where my ancestors are from, it very much feels like home.
I pay my respects to the elders, both past and present.
And still to come.
And I recognise their continuing connection to the land, waters and culture.
And thank you for allowing me to live and work here in your place.
In this together.
Okay. Alright, so our acknowledgement to country. I'll just bring our PowerPoint back up. So, what do you know about pulse rate and respiratory rate?
So the pulse rate is basically the number of heartbeats in a minute.
Yep.
The respiratory rate is basically the number of breaths in a minute.
Yep, that's good. When do you think you will need to check the pulse rate and respiratory rate for your patient?
So you usually do it at the start of your shift, and then throughout your shift, the number of times, I guess it depends on the company you work for, and you'll also do it at the end of your shift as well.
Yeah, that's good. So yeah, you've got a good understanding there that I can see. Yeah, you're right about depending on your workplace policy and procedure. That's very important. We also want to do it at the start of your shift, like you said, because we want to do it as baseline observation, so you know what your patient is like at the start of your shift. If there's any deterioration during your shift, you do another check during the deterioration, just so then you can compare it to the baseline observation. And it's always the comparison that will be able to tell us more of what is going on during a deterioration. So it's important to do it at the baseline and also at the company's regular interval. As stated in the policy and procedure, some companies might be 4 hours to 6 hours interval, depending on when the last one was done. But it also depending on individual patient condition as well. If your patient just comes back from like surgery, then they might need more frequent observation. It could be every hour, every half an hour, just depending on the severity of their procedure as well. So yeah, that's good. You've got a really good understanding there. So respiratory rate and pulse rate is what we call the vital signs. What do you know about vital signs?
So the vital signs, I guess, is the essential measurements that is required to determine whether or not the patient is stable, I guess.
Yeah, that's good. Pretty much what you said, but in a more wordy definition is the measurements of the body's basic and essential functions. So what that essentially means is all these sets of numbers will tell you about the basic function and how the individual body health status is. So apart from the respiratory rate and pulse rate, what do you think is also vital signs?
I would say blood pressure and also temperature.
Yeah, that's good. So pressure and temperature are exactly what vital signs would include as well. And apart from those two, there is actually also the oxygen saturation. So together, all 5 of them would make a complete vital signs observation. So all these 5 numbers would tell us about how well the human body is at that moment in time when you take the observations. Any questions so far?
No.
So starting with pulse rate, it is exactly like you said, how many times the heart beats in 1 minute. We always go by the unit of 1 minute, so it will be how many beats per minute. Same as respiratory rate, it will be how many breaths per minute. So what do you think is the normal pulse rate?
I would say averaging between 80 to 90.
Yeah. So it's good that you give us a range because not every single individual has the same heart rate. But our range is normally a little bit bigger. It's normally between 60 to 100. But that also depending on the individual health condition as well. Some athletes, they might only have their normal heart rate in their 40s, which is completely fine. But there's some patients, maybe they're a bit more frail, their heart rate might be going up a bit higher. It could be up to 120. That might also be normal and healthy for them because of what their past medical history is like. And another thing that it also depends on with the range is also where your workplace is. Different workplace will also have a different range. So some workplace might have normal range of heartbeat for 60 to 110 beats per minute. So it's always important to know what your workplace is with their normal range for pulse rate. What other things do you think is what we will be mindful of when we take a pulse rate?
I guess you want to avoid taking the pulse rate when the patient has just done physical activity.
Yeah. Why do you think we want to avoid that?
Because physical activity will increase the heart rate, and that's not a correct reflection of what's their normal heart rate.
Yeah, that's good. Exactly like you said, we want it to be in a resting position, want them to be comfortable, not short of breath. Like if they come back from a long walk, they might be short of breath. We don't want to take their pulse rate then because it's not truly reflecting on their health status. Their heart rate could just be running high because they just exercise. So resting is very important because only then it will show what their heart is actually doing. So here there's a few other pulse points that we can have a look at that we can also measure. But today with our manual pulse rate, we will only be focusing on the radial pulse, which is just around your wrist. But we will also have a look at the temporal pulse, which is on your forehead, and also the brachial pulse, which is on your elbow side. Any questions so far?
No.
Okay. So moving on to respiratory rate. So it is like you said, how many breaths a person takes in 1 minute. What do you think is the normal range?
I would say 15 to 20.
Yeah. 15 to 20 is almost there. Like with 20 is correct with our higher side of the normal range, but we are a bit more lenient on the lower side. We're happy with 12, especially when the patient is during the night, they're sleeping. Normally their breathing is a bit slower, so we're happy with 12 to 20 normally. But again, that will depend on your workplace and also the patient condition as well. Again, like we want to take it when the patient is resting, is comfortable. We don't want to do it while they just come back from a walk because that's also not truly reflecting on their breathing as well. What do you think is considered as 1 breath?
When you inhale and exhale, that I would consider like inhale and exhale will be 1 breath.
So in and out, and that's
Yes.
1 breath.
Yes.
That is exactly right. So like the slide says here, 1 breath equals to 1 inhalation, which is reflected with the rise of your chest, and 1 exhalation, which is the fall of your chest. So 1 rise and 1 fall, that is 1 breath. this slide shows a little bit more on how you can look out for respiratory rate. So when a person breathes in during inhalation, we can see the chest expands. So that expands will make the chest goes up, and at the same time your diaphragm will contract because you're trying to have more space for air to come in. And when a person exhales, the diaphragm will relax into more of a dome shape compared to when it contracts, and also your chest will fall, and that way the air will be forced out of your lung to allow more gas exchange, more fresh oxygen to come in. Any questions so far?
No.
All good. So now we'll watch a quick video on how to do the manual pulse rate and respiratory rate in a more clinical setting. There's a little bit of technical difficulty today, but we're getting to it.
Get Claritine for fast and non-drowsy allergy relief. No one covers more allergens. So whether it's indoors or out, you can be clear to enjoy the simple things. Feel the clarity with
Hi and welcome to Nursing School Explained, and this video on assessment of respiratory rate and pulse or heart rate. We typically combine those two assessments and count each one for 30 seconds. The reason that we do that is because the respirations is one of those vital functions that we actually have control over. So the problem is that if we actually tell our patient that we're going to assess their respiratory rate, they are aware of it and they might alter their respiratory rate or frequency or depth because of it. So what we'll do is we'll assess the patient's radial pulse, count it for 30 seconds, and then continue to hold our fingers at the radial site, but for the next 30 seconds we'll actually pay attention to the patient's chest rise and fall and count their respirations for 30 seconds. Then we'll have to remember both numbers and multiply them by 2 to have the 1 minute heart rate and the 1 minute respiratory rate. So let's go ahead and do that. Hi, I'm going to assess your pulse today. Is that okay?
Yes.
Okay, can I see your arm please? Thank you. So I'll place my fingers right at the patient's radial artery and I want to use my index and middle finger. I want to make sure that I press down firmly enough so that I can feel it, but not too firm where I actually could occlude the pulse and basically obstruct the blood flow. Sometimes you have to kind of move the fingers back and forth a little bit just to see where exactly that pulse is. So once you find it, then we'll start counting. you. So in this case, I counted 24 on the radial sides. If I multiply this by 2, I get 48, which is a little bit on the slow side, but for my particular patient, I actually know that that's his norm. And then for respirations, I counted 6 per minute, and if I multiply it by 2, it gives us 12 respirations per minute. And then you would go ahead and record the findings, and definitely take care of your patient depending on what the next step will be. Thank you for watching Nursing School Explained and this assessment on pulse and respiratory rate. We'll see you soon.
You still there? Good. So how did you find the video?
It was very informative, yes.
Yeah, quite clear.
Yeah.
Yeah, good. So now we'll move on to a bit of demonstration and a little bit of practice time for you, and then we'll do the assessment afterwards. Yeah. So we'll invite our volunteer patient back. Alright, so before we go ahead and start taking a manual pulse rate and respiratory rate, when we first enter the room, is there anything you could think of that we need to look out for?
I would say make sure that his surroundings doesn't have any obstacles.
Yep, that's good. So checking for danger, checking for risk, that's good.
Yeah.
Yeah, obstacles is definitely one of the biggest risks that could have in a patient room. Other things that could be puddle on the floor that might be slippery. There might be blood that you might be bleeding from somewhere that you don't want to go ahead and just touch it. So yeah, that's good assessment for risks. And afterwards, we will want to introduce ourselves as well. So, hello, my name is Natalie. I'm going to be your nurse today. Is it okay for me to take your pulse rate?
Yes.
So at that point in time, we also got their consent, so that's good. We want to make sure they know who we are and what we're going to do, and they're happy with what we will be doing. So yeah, we've got their consent, then we can go ahead and look for their manual pulse rate. So can I have your arm, please? I'll just put your arm on a pillow, just to make sure they're comfortable. And then just use your middle finger and your index finger. Slowly press down on the wrist, just below the thumb. And you should feel a pulsating pushing against your fingers. So you don't want to press it too hard because that might obstruct your blood flow. And you also don't want to use your thumb because your thumb is also not as sensitive, so you might not be able to pick up the pulse as much. If you can't find it, so move around until you can find the pulse. You want to have a go?
Yes.
Yeah.
Okay. Hi, my name is Samani. I'll be a nurse today, and I'll be taking your pulse rate.
Sure.
You can find it?
Yeah.
Yep. It's quite obvious push to you?
Yeah.
Yep, that's good. So in the video, they mentioned to note down the pulse that you could feel in 30 seconds and times it by 2. That is a very common technique that we would use, spending the next 30 seconds to look at the rise and fall of the chest. That is because we don't want to let the patient know that we're taking the respiratory rate, because subconsciously they might be altering their breathing pattern, so it's not truly reflecting on their rest rate again. And but for the purpose of today's practice and assessment, I would like you to take a whole minute of manual pulse rate and a whole minute of respiratory rate. But you can just pretend that you are still taking the pulse rate for the second minute, so you're looking at the rise and fall of the chest.
Okay.
Yep. So looking at the respiratory rate, we will keep taking the pulse rate, It doesn't matter whether you can actually feel the pulse at this time
Mm-hmm.
because you're focusing on the respiratory rate.
Yes.
So looking at the rise and fall of the chest and also looking at the timer, counting how many in and out in 1 minute. Would you like to have a practice?
Okay.
Yeah? Okay. Are you happy with your practice? Do you want to practice a bit more before we go ahead with the assessment?
No, I think I'm good.
Okay.
Yeah.
So for the purpose of the assessment that we're about to start, we will be taking the pulse rate, one arm on the side. So I will accept the pulse rate that is plus or minus 2 beats of mine. So let's say if I take a reading that is 68 beats per minute, I will accept from 66 to 70. And for the respiratory rate, I will accept plus or minus 1 breath per minute. Is that
Okay.
clear?
Yeah.
Yep. Okay. So you can start your assessment from your introduction.
Okay. Hi, Harry. My name is Hermione. I'll be a nurse today, and I'll be taking your pulse rate.
Sure.
Can I please have your hand?
How'd you go?
So I think his pulse rate is about 72,
Mm-hmm.
and his breath was about 17.
That's good. So my reading, I've got a pulse rate of 75, which is within your plus or minus. And your respiratory rate, you've got 17. That is exactly what I got as well.
Okay.
Yep. So this is not your part of your assessment anymore, but I would also like to show you how to record down the pulse rate. So after you take your pulse rate, you want to plot into the graph here.
Yeah.
In that way, you can look at all of it and compare the trend.
Okay.
Yeah. So after you finish all that, don't forget to sanitize your hands as well. Part of the hand hygiene, so you don't bring it to the next patient or bring it to yourself.
Yes.
Yeah, before you leave the room, we would also want to make sure that make sure the patient is comfortable with the buzzer next to them so they can reach out for help if they need to. And just make sure whether they need anything else as well.
Yeah.
Yeah, so we can just say, oh, buzzer is on the side here. If you need anything, just press the button, then we'll come and help you. And do you need anything else for now? Okay. Yeah.
In your training, you also mentioned the other two methods of taking the pulse rate.
Oh, the temporal pulse and the
Yes.
brachial
Can
pulse.
you
Yes.
just demonstrate that to me?
Yeah. So temporal pulse is between the hairline and like the end of the eyebrow, sort of in this area. So want to just press lightly again with the index and middle finger until you can feel a push.
Yeah.
Yep, that's good. And the brachial pulse is just now with the radial pulse is on the thumb side of the wrist, whereas the brachial pulse is on the pinky side, but in the elbow. If you can't find the pulse, also go around the area.
Yeah.
You can feel it?
Yeah.
That's good. Yeah, good questions. We have also tried out to feel for the temporal pulse and the brachial pulse. So those are the other pulse points that we are quite frequently used as well.
Yeah.
So I'm happy to say that you've passed your assessment. That's good. And if you need more practice, feel free to contact me again via the email which I've sent to you last week, where all the pre-reading handouts were attached into. That is my contact there. If you have any other questions, you can also shoot me an email. We also host this session regularly, so we'll send out generic email on how to sign up and stuff. So if you want to redo the session again, that's fine. Just reply to that email. Any other questions for now?
No.
No? Okay. Then I'll just get you to fill out this feedback form. Thank you. And yeah, I'm really happy with your assessment today, and yeah, best of luck, and we might see you again in another training.
Thank you. Thank you,
Thanks,
Harry.
Harry.
Thank you.
I stuffed up.
At least